just a minute. Okay. And we've got a live here and an ad. Okay, yes, we're live. So welcome to the TRT and Hormone Optimization YouTube channel, everyone. And we're live with Dr. Amy Wecker. Welcome, Amy.
Hi, thanks for having me back.
Hi, welcome. A lot of people have enjoyed the video you made on how to start HRT for women. So that was a very good video, very comprehensive and short. But at the end of that video, you talked about HGH and the benefits of it. And so I got a few questions from different women. So what should they do about HGH? Should they just take the injections, or what is your take on it?
Okay, so this is actually a pretty interesting topic. Well, everything is an interesting topic, right? So let's talk about this. So growth hormone really is the fountain of youth, and it helps us build muscle, it helps us burn fat, it gives us energy, it helps us recover well from exercise, it makes us resilient, it helps our sleep, it helps our skin. So there really are a lot of benefits. However, I don't actually like to use growth hormone in my practice, and I will tell you why. So growth hormone is released in a pulsatile manner, and you get 9 or 10 pulses throughout the day and night, and the biggest one is in the middle of the night, which of course is part of why it's so important to get good sleep, right? So when people wake up in the middle of the night and eat, that's actually one of the worst things you can ever do. That's very, very pro-aging. So yeah, it's good if you are having a really good sleep around 2 or 3 in the morning, and also if you go to bed on a fairly empty stomach, those things are going to really optimize that nighttime pulse, which is the biggest one. So anyway, that being said, why is growth hormone released in a pulsatile manner? Well, because that's how your body wants it. That's human physiology. If your body wanted it to be a different way, it would be a different way. And so it's like growth cleansing, growth cleansing, growth cleansing. And it's really important that you have those pulses and then those periods of cleansing. And so you don't want growth hormone to be turned on all the time, okay? Because again, this is not how the body wants it. And so anything that you take exogenously, like any vitamin, any medicine, when you take it, your level goes up, your level stays up for some period of time, and then your level comes back down. That is just how the drugs work, the pharmacokinetics of these drugs. So for most things, like a vitamin D, let's say, that's fine, right? Because your body wants you to just have a nice high level of vitamin D all the time. So you take it, your level goes up, great, like you take some more a day later and it's all good. But with growth hormone, you don't want it turned on all the time. You have to have those pulses. And so when you take exogenous growth hormone, you can interfere with that pulsatile release. And so you can get some good results in the short term, but you have to be really, 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 really careful, because you don't want to have that turned on growth hormone for too long. So, and then because you can end up with kind of some weird side effects, like some strange things can happen to your body. You can get like the thickened jaw and like a big hard belly, and the biggest thing to be concerned about, of course, is the potential of getting cancer, because it's growth hormone, and you don't want to be in an unopposed state of growth all the time. Okay, so then what are we supposed to do? How do we get the benefits of growth hormone without using growth hormone? So we have a whole bunch of peptides that stimulate your body to produce and release more of its own growth hormone in that same physiologic pulsatile pattern. And these are called the growth hormone releasing agents. And these are what I actually recommend. So Sermorelin was a big one that was being used for a long time. These are peptides. So Sermorelin was a big one that was being used for a long time, and we still use Sermorelin. And then kind of the next generation after Sermorelin is ipamorelin. So ipamorelin is really like what we use now, and we combine it with something called CJC 1295. Now, what the hell is that? So the CJC 1295 helps potentiate the action of the ipamorelin. So basically, if you were just going to take ipamorelin, it really only affects the pulse of growth hormone, right after you take it, or a couple of them after you take it. But so when we combine it with the CJC 1285, then it enhances the action and makes it longer. And so all of those pulses get enhanced. So I personally have been on, I was first on straight ipamorelin, but then they came out with a combination product. So I've been on ipamorelin, CJC 1285 on and off for close to 5 years now, actually. And it's amazing. I mean, you cycle it, you go on and off, but it's incredible. So you inject it at bedtime, 5 nights a week, at least 2 hours after your last meal. And that, of course, is because the growth hormone releases are enhanced by not having a totally full stomach. And so, I mean, nothing will happen to you if you inject it after you eat, but then you're not going to get the complete benefits of it. And, it's not cheap. So you want to make sure that you're really maximizing your benefits. And so it works out really well, because you can do it something like Sunday to Thursday night, then you get the weekends off. If you want to go out late, have some drinks, eat late, because you don't want to do 7 nights because you can oversaturate the receptor. So I hope I'm not giving too much information here, but the stuff really is really pretty magic.
Okay, very interesting. Thank you. You mentioned vitamin D there. There was a question also about vitamin D. What's your recommended dose for men and women, and what levels do you seek to reach with that?
So I'm obsessed with vitamin D. I think everyone knows that. And actually, it's so important. I mean, not only like for your energy, your mood, your bones, your calcium metabolism, but your immune system. It's protected against COVID, which obviously is unfortunately something that continues to be very relevant. I don't think COVID is going anywhere. And I hope we don't all want to live our lives in a bubble. So I think the best strategy is just to try to make yourself as healthy as you possibly can, living in this world where it's not going away. So I think a good place to start would be 5,000 IUs a day. Now, we're all different, okay? So that's just a general dose, but that might not be totally appropriate for every single person. So you start with 5,000 IUs a day, and then you check levels. And then based on your level, you can go up or down. So although probably you don't have to go down. So I think the minimum level to go for would be 60. I think better if your level is 80. I hear different things like between 60 and 100, between 80 and 120. But I think that 80 really is a pretty good level to go. From 80 to 100 probably is optimal. Anything over 60 is fine. It's great. I mean, you don't want to split hairs. Like if it's 75, it's fine, but under 60, it's not enough.
Yeah, okay. Because a lot of labs here in Europe, I guess, do have ranges from 20 to 40 something. So that's really too low.
And it's the same measurement that we use here?
It's the same measurement, yeah.
Yeah, no, 40 is too low. So here, when you get the readings back from our commercial labs, they give you a range of 30 to 100. But 30 is definitely too low. Yeah. And it's crazy because, I live in Miami. So of course we have tons of sun, but just because we happen to have a lot of sun doesn't mean that everyone is outdoors in it all the time. And I routinely see young, healthy people with vitamin D really low, 20. I saw one the other day, vitamin D of 9. I mean, it's crazy. And it's such an easy fix. The capsules are cheap. They're readily available. They're safe.
Yeah. And there are no side effects to be expected because it's fat soluble.
I mean, according to what I've heard from my professors, there's no known toxicity, and you can even take your level over 200 in a very safe way. I don't recommend getting it that high, but it's safe. So yeah, there's really no downside. And the fact that it's fat soluble is actually really nice because you can get away with taking a bunch of vitamin D a couple of times a week if you don't feel like taking it every day. So I know I don't necessarily take everything every day because I think we've talked about this before, you end up taking so many supplements and sometimes you just don't feel like taking them. So I would say that probably 2 or 3 times a week, I'll take a few vitamin Ds. And that way you get all the vitamin D you need and you don't necessarily have to take it every single day.
Yeah, right. Okay, so we got multiple questions now in the chat box. A lot of people are asking always individual measurements and protocols and so on. But let me generalize the questions because that's most interesting for everyone. So someone asked about androgel, so testosterone gel with a certain amount of testosterone, 13. Should you increase, yes or no? But I guess the most important question is, what are your thoughts on testosterone gels?
Well, I'm not against, I'm not against topical testosterone. I think that when you use androgel in men, you are going to definitely get a limited benefit. So you are going to raise the testosterone, but you're not going to raise it that much. So it really depends on where you're starting and where you want to be. I know some people are just dead set against injecting themselves, and I get that. Injecting yourself is not for everybody. So androgel can be a good alternative, but know that you're not going to have the same results as you do with an injectable product. Now, I don't have any experience using androgel for women, but I do have experience using compounded topical testosterone for women. And you can get good results with that for sure. The compounding pharmacy that we work with at the Medical Health Institute, Crestview Pharmacy in North Florida, they're amazing. I love them. They make us these rapid dissolve tabs. And I really like the tabs. You take the tab, you break it in half, and you put both pieces underneath your tongue and you let it dissolve. And I know that there's a lot of controversy about sublingual hormones, and people say, well, sublingual is really oral, you're really swallowing it, and swallowing estrogens and testosterone is not great for you because the liver doesn't really like it. But I would beg to differ. I think that the old sublingual preparations were very different than the sublingual preparations we have now. So I do agree in the past that a lot of the sublingual stuff really was oral, but Crestview, I've looked at all of their data. They make amazing products, and they genuinely are absorbed into the blood vessels underneath the tongue. They don't affect the liver. It's genuine sublingual administration. And so I think that that's, to me, just so easy. The creams can get kind of messy, and you never really know. You have to really rub it in so hard to try to drive it through the epidermis into the dermis, and you never really know if you're rubbing it in hard enough. And I love these sublingual tabs.
Mm-hmm. Let's also add that compounded testosterone at 10 to 20% cream transcrotally for men is also a good option, right?
Yeah, absolutely. But again, you really have to rub it in, pretty vigorously to drive it through the epidermis into the dermis. So I don't know. And then I know I've had plenty of patients complain over the years about androgel and Testim, especially Testim, that it's like sticky and it doesn't dry well. And so I'm not against those things at all, but I think that there's other methods that may be easier to use.
Okay. Right. Big Daddy 92 is asking about the hematocrit of 51.7, hemoglobin of 17.7 grams per deciliter, and so on and so on. But the question is there a point in red blood cells, hematocrit, and so on, that one should donate blood if you're on TRT, of course?
54.
54, okay. So that's the number you say to man, go and donate blood.
Yeah, that's what I've learned in my anti-aging studies. That's what everyone says. When you have a hematocrit of 54, you need to donate blood.
Okay. Someone asked also, can you use ipamorelin CJC 1295 while on TRT?
Oh, 100% you can. Yeah. Anti-aging is a symphony. So what I like to do is at my initial visit with the patient, I like to put them on some hormones and some supplements. And I don't like to use peptides at the initial visit because I think the body only wants to do so much at once. It's like going through puberty, right? It doesn't happen in a day. It takes some time. Going through menopause, it also takes some time. So I like to start some hormones and some supplements. And then when I see patients back for their follow-up, if everything is more or less okay, of course you can make some dose adjustments, but if things are more or less okay, then I will offer peptides at the second visit. And absolutely putting it all together is how you move towards optimum health.
Mm-hmm. Vanessa Gomez she says, I was diagnosed with PCOS many years ago, wondering if you treat that, and she's interested in some more information.
Yeah, I do definitely treat PCOS. My experience is that as women get older, the PCOS kind of burns itself out. And actually, I know it can be really problematic when you're young, but then as you get older, actually, you're going to have higher testosterone levels for longer than someone without PCOS. So it actually can be beneficial as you get older because your testosterone is going to drop more slowly. So it does kind of burn itself out. But yeah, no, absolutely. Absolutely, I treat it.
Mm-hmm. And how is it treated?
Well, you can, it depends really on what the labs look like. So you can give metformin. Metformin is a big one to take care of the hyperglycemia. And then, you have to take a look at the hormones and make sure you balance them. Treat the skin.
Mm-hmm. Yeah. Kiki writes, my boyfriend has hypogonadism. He feels tired and drained all the time. He started androgel 50 milligrams daily. Are there other things he can do to get more energy?
Well, I mean, I'll have to look at all of his labs, right? So, I mean, vitamin D, take a look at his thyroid function. But again, I mean, I don't know what his testosterone levels were, and I don't know what they are now, but androgel is going to definitely give you a limited benefit. You're not going to get, I mean, if your testosterone is, let's say 250, like it's not going to 800 on androgel.
Right. What do you recommend for men who want to go on TRT or need to go on TRT, but are afraid of hair loss? We keep on getting those remarks on YouTube, especially probably because I have no hair. So tell us, Amy.
I mean, the hair loss, there's things you can do for hair loss. There's vitamins you can take, there's topical products, but I mean, some of the testosterone, is going to get converted into DHT, but putting people on testosterone, it does not automatically lead to hair loss. We're all different, and you have to just kind of see, what's going to happen. I mean, honestly, with hair loss, the biggest thing is what your mom's male relatives look like. And if your mom's male relatives are all bald, I'm not really sure how much you can really do. And I mean, I think you should go on testosterone anyway, because it's going to make you feel good. So, I mean, again, you got to kind of balance it all out.
Mm-hmm.
One of my best friends actually had some pretty extensive hair transplantation, and he's on testosterone. He feels great. He looks great. I know that's not an option for everybody, but he did have hair transplants and they look fantastic.
Mm-hmm. And you have this micropigmentation now as well. You have many options, minoxidil, but you're probably no fan of finasteride neither.
Finasteride makes me nervous because, there's a small but serious risk of permanent sexual dysfunction. And I don't think there's any way to predict who it's going to happen to. And I mean, it's a small percentage of men, but if it happens, it can be irreversible. So I'm not a fan of it. I just think it's too risky. What do you think?
I agree. Yeah, I agree. So it's not worth it. Yeah, I've never cared about the hair loss. My grandfather, my mother's dad, he was all bald when he was 30, so I had no chance at all. So I started losing my hair way before TRT. So I don't know if it worsened it or not. I don't care. I still don't care. Another question on the CJC: is it with DAC or not?
Well, that's the with the DAC. Yeah, I think they usually put it in there.
Mm-hmm. Okay. Let me have a look through the questions. A lot of remarks. I've recently started on 100 milligram test SIP weekly. That's a man, of course, pilot Jeff. But I have started to split the dose to 50 milligrams twice a week. When you do that, doesn't the peak end up a lower amount, and should I increase slightly?
I like splitting the testosterone into the twice weekly dose, actually. So, a long time ago, I think that we were giving testosterone monthly actually, and then people realized it's not enough. And when I first started practicing medicine, we were giving testosterone every other week. Then they realized that's not enough. Then we started giving it every week. And now it's more common to give it twice a week, sometimes even 3 times a week. I think twice a week is nice. I like it because I think even once a week towards the end of that week, men are starting to crash a little bit. And I think when you do it twice a week, you avoid those big peaks and troughs. And I think 50 twice a week is nice. I mean, you have to look at the levels in terms of whether or not you would increase it. I mean, 60 twice a week is nice, but again, you gotta look at the levels and see what they are. But I think that 60 twice a week would be a reasonable dose for most men.
Yeah. A lot of people can't seem to figure out how to calculate their dose when doing every other day injections. Can you help out there a little?
Well, I don't know that it's really necessary to do every other day injections, but if you are going to do every other day injections, then basically you just take your dose and split it. So if it's 100 a week, then probably what you will do is like 0.2 every other day, which will give you, 120 a week. That's probably the best you can do. But honestly, I'm not really sure that's necessary. I don't know. I think twice a week is good. What do you think?
Yeah, well, I have been using the transcrotal compounded 20% cream for 4 years now with great levels and energy and all symptom resolution. So I really have no injection experience.
Right. Oh, that's great.
Yeah.
Yeah. I mean, like it's
Dr. Keith Nichols started me on that 4 years ago. I tried 1 or 2 injections with cysteine. That's the only thing we have here, and it has to be injected every 2 weeks, every 3 weeks. So I didn't really bother, and I learned from the American doctors. So, but my urologist here, he couldn't even believe this was a thing. So transcrotal cream. My own urologist told me, "You must be joking, right?" No, it's incredible. So.
Wow. Yeah. It's crazy to learn how different medicine is in different countries.
Yeah.
Like like I said, I'm not against the creams at all. Like we're all different. And if you're getting good levels and you feel good, that's awesome.
Mm-hmm. Yeah. I had some more questions. In your experience, which peptides and SARMs have you found beneficial in yourself and your clients? Do you use SARMs as well?
Not really. Well, personally, I take ipamorelin CJC, and I cycle on and off of it, but that's really been kind of my mainstay peptide. I also use quite a bit of BPC 157 for injury repair, and that's been amazing. So I always keep some BPC around, and I give myself a few injections a week, usually as maintenance. And if something starts to bother me, because I have a pretty advanced yoga practice, like I handstand and I do contortion, and so things happen. I mean, I'm about to turn 47, so the BPC is amazing, and I've used it in so many of my patients to heal their injuries. It repairs bones, ligaments, and tendons, and it's incredible. So that definitely is a really good one. And then of course Sermorelin. There's nothing wrong with Sermorelin. Now I did try MK677, and I have to say I was not crazy about that one. You get really hungry and you'll gain weight. So that is a bodybuilding peptide, but for me personally, I didn't like it. And the other thing that I really, really love is GHKCU. And this is a skin peptide, and it will regenerate your skin. And it's pretty amazing. So those, and CMAX, that's another one of my favorites. The CMAX nasal spray, that is a brain peptide, and it helps you focus and concentrate. And so those probably are my favorites.
Okay, so I'm just asking a question here. Someone asked, I have sexual weakness, so should I take testosterone injection? But he asked several times. I'm waiting for your answer, but I'm waiting for him to explain what is sexual weakness, because
exactly. That's not a medical term.
Yeah, no. So I asked him to explain more detail.
I mean, honestly, so in terms, you have to get a level, right? You have to go to the doctor, you have to get your blood work done, you have to get a level. Now, in terms of the one question that I will ask my patients that I think gives a better idea of what the testosterone is than anything else, I usually will ask, do you wake up in the morning with erections? Because, you know, desire is a complicated thing. And, you know, you can be in a relationship and you can be in an unhappy relationship and not be having sex. And it has nothing to do with your testosterone, you know, like sexuality and desire are complicated things. So I ask, do you wake up in the morning with erections? And if you never wake up in the morning with an erection, probably your testosterone is on the lower side, but the only way to really know is to get your level checked.
Right. So when referring to gels, is that the same as creams? I thought TRT creams were a quite effective application method for men. So we already answered that. Yes, transcrotal compounded cream can be very effective. I found it very effective. A lot of men have. So it's not the same as gels. So like 20%. So the gels are only 1 to 2%. And you have
that's a huge difference. Yeah.
And the transcrotal route has a 8 times better absorption
because
rate
the skin is thinner.
So yeah, the cream works well. What do we have more? Have you ever heard of a side effect with Sustanon causing an itching sensation when sweating?
You know, any drug can have any side effect, and people have variable sensitivities to these things. I mean, anything that you inject can have an injection site reaction for sure.
Yeah. Could be all kinds of things like hives or urticaria. You can be a reaction to whatever.
Yeah.
Any medication, any substance, really, even food.
The GHKCU that I'm like so obsessed. Oh, sorry, what?
Go ahead.
Well, the GHKCU that I'm so obsessed with for the skin, it burns at the injection site, like for everybody, like for hours. But you know, I don't care because it's so amazing for your skin. But definitely, yeah, even the ipamorelin, you could get a little itchy for a few minutes.
Yeah. Any advice for supplements or anything that could help a male for having healthy child with his wife? We want to get her pregnant and then switch to TRT. I have low-end normal T and I'm 27.
So probably the thing to use is clomiphene. And actually that's what I like to use in my young men anyway, because once you get started on testosterone, you know, you're on it for life, like all these things. It's not like, you know, you start, because people ask me this all the time, well, how long do I have to take it? Well, forever, because I mean, if you're not making testosterone now, do you think that like in 10 years, all of a sudden your body is just going to start making a bunch of testosterone? No. So once you're on testosterone, that's it. And so in my young guys, because I do see a lot of young guys that have low T, and I will usually give them a course of clomiphene to see if we can just stimulate their HPA axis to produce more of their own natural testosterone. And it actually works really well. Like I use it a lot in my young guys, and usually they'll get a big boost in their testosterone. I do 25 milligrams a day or every other day for about 6 months. And it can a lot of times raise the testosterone a few hundred points, and it'll stay there for years. So for a young guy that's looking to have a baby, for sure, that would be the drug.
Mm-hmm. Is it necessary to add insulin if HGH hires up blood glucose? If yes, what's the protocol?
I don't use HGH. I don't think that you should be injecting yourself with insulin if you are not diabetic. It can be super dangerous.
Yeah, and the HGH releasing peptides don't do that. They don't influence the glycemic.
I don't think, I mean, maybe a tiny bit, but I don't think so.
Mm. Okay, so we got a super chat from Jorge, probably. Thank you. And he's got a question, of course. He's on 100 milligram testosterone SIP weekly, 2 shots per week, sub-Q. What should be normal, free, and total test values in TRT? Any benefit on injecting intra instead of sub-Q? Is it good splitting doses in 3 shots instead of 2? A lot of questions.
Yeah, I think that the sub-Q injections work really well. And again, I don't know that there's really a benefit to 3 times a week over twice a week. I mean, I don't know. It just really depends on what you want to do. I think a healthy testosterone level for a man is around 700, 800, give or take. But, you know, we're all different. And when you check it, you have to see, like, is it a peak, a trough? When did you inject?
So when someone is injecting twice a week, when do you measure?
When someone is injecting twice a week, you want to measure probably the day before an injection.
Okay.
Well, no matter what I mean, I like to, because I like to get like either a mid-cycle or a trough, because anything besides a peak.
Yeah, of course. Before TRT, someone writes, I had delayed ejaculation. No, I am on TRT and I have premature ejaculation. Why is this? Any supplements I should take to help?
I don't think, not that I'm aware of. I mean, I think for premature ejaculation, it's behavior techniques, right? You wait until you're right about to ejaculate, and then you stop the stimulation. You can squeeze the head of the penis and you wait, and then you can start again. But it's all behavioral modification like that. I'm not really aware of any supplements. Are you? Am I missing something?
No, I think, no, I'm not a urologist, but I think you're right there. Back to the dissolvable testosterone pills. Do they behave more like the natural testosterone as far as the half-life in the body? Are these taken daily, and are they better than injections?
They're taken daily, and actually they make higher dose ones now for men. And they work really well. I mean, are they better than injections? I mean, I don't know. You know, they're different. I mean, they do work really well. And people at a certain point, I think people don't want to inject themselves. And so I think it's just another alternative option.
The talk you made recently, how to start HRT, can you do it before menopause? I guess that was all a bit for younger women, 40, 50, is it?
No, so we produce vast quantities of everything until we're about 25. And then things start to decline, but they don't all decline at the same rates. And so actually, I would say that, I mean, we're all different, but for the most part, I would say that a lot of women, by the time they're in their mid to late 30s, have pretty low testosterone, and they can benefit from a little bit of testosterone replacement. So that usually is the first thing to go for whatever reason. And then progesterone is usually the second thing to go. And again, you have to measure levels, but sometimes we know that we're progesterone deficient when we stop sleeping, when we start sweating at night, when our periods get dysregulated. And then estrogen, of course, is the last thing to go when we actually enter menopause. But there is a period of time for probably a few years before you're actually in menopause, where maybe you benefit from a little bit of estrogen as well, right? Because it's not like one day your estrogen is like here, and then the next day it's like zero. You know, it's a decline over time. So you can still be, producing enough estrogen to cycle, but you can still be having some menopausal symptoms. So during those perimenopausal years, you definitely can be on hormones. And then usually after menopause is when you'll get on a stable dose that you could really stay on. Like during the perimenopausal years, everything has to be constantly adjusted as your body keeps changing. But the hormones, they're really for women, I think, 30s, 40s, 50s, and older. I mean, I try not to, I see women in their 20s here and there. I try not to do too much to them because they're so young. But again, we're all different, and anything can happen at any age. You have to get a comprehensive lab panel done and take a look at it, see what's going on.
So like, for example, a woman of 40, imagine she's already started on testosterone, and next up is a little bit of progesterone. Probably then when she's 40, 45, she'll have a lot of years till she's get into menopause. So for the estrogen, is just waited out till menopause, right?
More or less, yeah. So like I said, I'm about to turn 47. I've been on testosterone for a long time. I was on the cream for a while, and now I take these rapid dissolve tabs. And then I've been on progesterone for the last couple of years because I stopped sleeping and I started sweating at night. So then I checked my progesterone level and it was essentially zero. And then more recently, I started taking the most tiny little amount of estrogen with my morning hormone tab, just literally a drop, because my estrogen levels had gone down and I was starting to get a little bit sweaty during the day sometimes. And so it's the tiniest little bit, but I'm going to probably need that support until I actually go into menopause, which hopefully I have another, let's say, 5 to 10 years or something. So yeah, we're all different. You have to see how you feel. You have to measure the levels. I mean, medicine is an art, not a science. It's an art with some scientific elements to it.
Yeah. You also mentioned in your recent talk, thyroid. Are you only putting people, women, men, on thyroid when they have a hypothyroidism, or do you also do it just for optimization and maybe more energy?
No, there has to be, you have to have a reason. I mean, if all the thyroid indices are totally normal, then I definitely don't put anybody on thyroid medicine. But I mean, in conventional medicine, they'll let your TSH go pretty high. I mean, I will usually start offering medicine for a TSH above 4.
Mm-hmm. Okay.
I don't let it go too high, and I take a look at everything. I take a look at the free T3. If the free T3 is too low, we could also talk about thyroid medicine. But I mean, if somebody feels tired but their thyroid looks perfect, absolutely not.
Mm. Bella Kim asks, where else can a woman apply testosterone cream instead of inner thighs? I have learned switching the application sites is encouraged.
Yes, you have to switch the application sites, because if you don't, you're going to grow hair there. So yeah, the inner thighs, the inner arms is a good like in here. And you can put it in your vagina if you want to. There's good absorption, but I think if you alternate between the 2 thighs and the 2 inner arms, then you're only putting it on each site 1 to 2 times per week, and that should minimize any excess hair growth.
Okay. Can you still have kids on TRT? I'm also on enclomiphene.
Yes, definitely.
Okay. A lot of questions coming in. Okay, Amy, what's your diet like? Do you still eat leafy greens that contain goitrogens, thyroid disruptors, or oxalates?
I do. I mean, so I have to tell you, I have read, I don't even know, countless numbers of various diet and nutrition books, and I've experimented myself with a whole big variety of diets. And the way that I eat clean. I eat a lot of protein. I do my best to eat ethical protein. So I go for the, pastured eggs, organic free range chickens, organic meat. But I definitely do eat a lot of protein. I eat a lot of vegetables. And, I mean, I went through this phase where I wasn't eating peppers because of the lectins. And then I decided that stuff doesn't really affect me. So I do eat all different kinds of vegetables. I eat some fruit. I was keto for a while, but I definitely do eat carbs, and I eat like fruit and sweet potatoes. Like, I don't eat any gluten. That's the one thing I'm super strict about. No gluten. I don't eat many grains, maybe a little bit of rice here and there, but the majority of my carbs are, again, from fruit and sweet potatoes. I think almost anything in moderation except for gluten. And I know I don't eat a lot of dairy. I try to stick to A2 dairy. So I do eat sheep yogurt. I don't drink milk. I don't eat a lot of cheese, but when I do, I try to eat goat and sheep cheese. Mm-hmm. I eat some nuts.
Okay. All good stuff. You're getting a lot of compliments there. That you look good for your 47.
Oh, great. Thank you. Well, I am an anti-aging doctor. You should never go to an anti-aging doctor who looks old.
Right. People are saying you look like you're in your 30s, so that's very good.
Thank you.
Doesn't progesterone tend to promote higher body temperature?
The progesterone actually will stop you from sweating at night. So I don't think it promotes a higher body temperature. Okay. We use it to control the night sweats.
Mm-hmm. But maybe the sweating makes you cool down your temperature and you stop that.
waking up in the middle of the night, like drenched in sweat, like that's a horrible thing. So yeah, the progesterone controls that.
Okay. Once I get on testosterone, how often should I test my levels, and which labs are important to test?
So I think you want to get an initial follow-up at 2 to 3 months, and then probably, you know, and then in maybe another 4 to 6 months. And then once you're totally stable, once a year should be okay. But I prefer, like, you know, 2, 3 times a year if you can. It just depends on what you can afford and what you have access to. And we do a full lab panel when we do labs. So you, of course, you have the free and total testosterone, but you know, you also need to check an estrogen, because you want to make sure that your estrogen level doesn't go too high. And then all this stuff that, you know, that we always check. We check a full panel every time.
Sinai Harel says, I just wanted to thank you for all the knowledge you give away. So I wanted to share that with you.
Thank you.
Can you take liothyronine with food? And generally, how do you prescribe thyroid medicine? What's your opinion on T4 monotherapy and SRT3?
I am not a big fan of T4 monotherapy because you have to have some T3. And so I don't actually, I'm not against compounded thyroid medicine. I just don't really use it myself, so I don't have a lot of experience with it. I prescribe Armour and NP thyroid exclusively. So those are basically natural thyroid medications that are made out of pig thyroid. And so they contain everything that's in the thyroid. You get T4, T3, T2, T1, calcitonin, everything. And that has been, I've been prescribing that for about 10 years. I take Armour myself, and it works out well. I've never had any issues with it. So again, I'm definitely not against compounded thyroid medicine. I've just never felt the need to really use it, so I don't know too much about it.
Mm-hmm. The thing that always keeps on coming back is I have normal testosterone levels according to my GP, but still I have the low T symptoms. What should I do?
Well, you have to look at the free testosterone and the sex hormone binding globulin also. So sex hormone binding globulin is a carrier molecule that carries testosterone around your bloodstream. And if the SHBG is too high, then you can have a low free testosterone, even if your total testosterone is normal. And when you say normal, what is the number? Because maybe it's 400 and your doctor's telling you it's normal, but that's not enough. And maybe you need it to be 700. So that, like, normal, I mean, it's like, you need numbers. Like that word is just totally meaningless.
Yeah.
It's like when you hear about people getting, you know, severe COVID and they're healthy. Like, but are they healthy? I mean, if we examined their lab values, like, you know, they appear to be healthy, but we don't really know what's going on.
Mm.
You don't know until you really do a full evaluation.
Yeah. But still, a lot of doctors are telling people your labs are fine, so don't worry about the symptoms. You should consider the symptoms as well, of course.
You have to consider the symptoms, absolutely. And like when I go over labs with my patients, I mean, I will sit there and I mean, I go through them and we talk about the numbers. I mean, you know, I mean, not everything, right? Like I'll say, oh, your CBC is fine, you know, you have plenty of blood, not too much. But in terms of the hormone levels, I always discuss the actual numbers because I think it's important.
Mm-hmm. Okay. Can the doctor talk about why she is avoiding gluten? Do you have celiac disease?
I don't know. I don't have celiac disease. It's very pro-inflammatory, and it's not, we all have varying sensitivities to it, of course, but it's not great for anybody. And for me, when I eat it, it makes my stomach hurt, and it makes my joints a little uncomfortable, and nothing horrible happens to me, but I feel much better when I don't eat it. And it's just been so long now, I don't even miss it. And then, of course, when you don't eat gluten, that naturally will keep your carbohydrate intake on the lower side, and it will help keep your weight healthy. It stops you from eating a lot of junk food that is packed full of gluten. I'm not against eating a dessert every now and then, but it's really pretty occasional, because most of the time when I go out, there's no gluten-free dessert, so I just don't eat it, you know. And I mean, again, I have a creme brulee every now and then. It's not the end of the world. I'm not eating it all the time.
Yeah. I sweat often during sleep, but never considered it was an issue that could be resolved. What should I look into?
Progesterone level, you got to have it checked.
Yeah. Any other thing?
I mean, you have a full panel, really. I mean, you got to look at at all of your hormones. You got to look at your thyroid.
Yeah. What are you checking when a woman has difficulties to reach orgasm? Hormones or genital issues?
That's a very, very, very complicated question. So I think you have to, like, if it's always been a problem, then I mean, you really need to look at some psychological factors. Is it only with a partner, or are you unable to reach orgasm when you're masturbating? Because those are different things too. So if you can easily give yourself an orgasm, there's nothing physically wrong with you. You have to look at the medications you're on. You know, like a quarter of America probably is on an antidepressant, and those really interfere with your ability to have an orgasm. I mean, there's a lot of things. That's a complicated question.
Mm-hmm. I already had a ton of videos on this very channel about how to improve libido for men, but how to improve libido for women?
Well, testosterone, I mean, that's a big thing. I think taking testosterone makes a big difference. And for women, I think also, you know, the brain is the most powerful sex organ. And I think that sometimes women have a hard time expressing what they want sexually and what they need. And, you know, if they're not really happy in their relationship, they're not going to really feel sexual. And that has nothing to do with physiology. And I always ask my patients when, you know, when they talk about having sex problems, I always ask them, do you like your partner? Because sometimes then they'll say, no, you know, we're fighting a lot, or the man is having, you know, some kind of problems, or, I mean, so you get into these things and it's complicated. And then that really has nothing to do with the female physiology at all. It's a lot of psychological factors. So, but certainly testosterone is a big thing to restore a libido that used to be there and then disappeared with age.
So there's testosterone, there's the relationship, the psychological effects, and any other supplements that might help?
I mean, you know, we have, there's a peptide PT141. Sometimes it helps, sometimes it doesn't. We got mixed reviews, but certainly that's something that you can try. Oxytocin is something to try, and that's not really a supplement, it's a hormone. Like our compounding pharmacy makes us these sex pills, and honestly, you know, I've taken them several times with very, very, very mixed effects. So I'm not really sure. Also, nitric oxide, that's a big thing, nitric oxide. So you can take nitric oxide capsules, or you can eat a lot of green leafy vegetables, and that will improve your microcirculation, which can also help with sexual function. And we have a machine. So there's a Gaines wave, which was developed. It's basically ultrasound technology that was developed to break up the plaques in the penis to give you a better circulation. And you can put a different attachment on the machine, and then they call it a FemiWave, and you can use that for women also to kind of restore the microcirculation. So, but that, I mean, like a young woman theoretically shouldn't have circulatory problems, but certainly if you're older, if you have diabetes, then there could be some vascular issues.
Yeah, sure thing. Okay, in men there's also zinc.
Zinc, yep.
Helps for women too.
Okay. Yeah, I don't know too much about that, honestly.
There's a lot of questions coming in for men always to improve the libido, but I don't know if that's a common question for women actually.
People don't usually ask me, really. I mean, because it's really testosterone. I don't know about zinc for libido for women. I mean, I'll have to look into it. I honestly have no idea.
No, but the question, how to improve my libido?
Oh,
many women struggle with that.
Women do struggle with it. Oh, absolutely. Absolutely. And the biggest thing is, you know, but usually when I check their labs, they have a testosterone deficiency. Okay. And you give some testosterone and the women really just perk right up. And you use, you know, a little bit, you know, somewhere between 2 and 5 milligrams a day of the rapid dissolve tab. So it's just a tiny fraction of what we give men.
Okay. 10 more minutes, so then we have an hour. Okay, deal.
Okay, wait, but I actually have to see a patient at 2. 5 more minutes.
Okay, yeah, sure. You give me a sign. L-citrulline or citrulline malate for nitric oxide production, which is the best?
You know, I'm not sure. I know that Berkeley Labs makes nitric oxide capsules, and they're great. They work really well. They're great for, you know, for your circulation, for blood pressure. But in terms of, you know, the precursors to nitric oxide, yeah, I'm not sure. I don't have an opinion on that. I'll learn about it.
I live in a very noisy area. Is there any hormone manipulation one can do to take into account to sleep despite this?
I have to figure out a way to make it quieter. I mean, progesterone definitely helps with sleep, but I mean, you know, it's not like taking a Xanax.
Maybe one more good thing there. When is the best time for a woman to check testosterone? Like in the 14th day of the cycle?
It doesn't really matter. We usually try to get labs between days 19 and 21, because that's when you're going to get the most accurate levels of estrogen and progesterone. And I mean, presumably you're doing all your labs at the same time. So day 19 to 21.
Okay, so let's take the last question there, a question that has been answered and discussed about several times on this channel. Is high estradiol normal for people on TRT? Are there any symptoms? Does it has to be controlled with aromatase inhibitors? What's your take?
Yeah, well, so I mean, if you take testosterone, some of it is going to get aromatized into estradiol, and your estradiol levels will go up. And for a long time, we were definitely giving a lot of aromatase inhibitors, but actually now we don't use them as much. It turns out that a little bit of extra estradiol is fine. So the current thinking is that unless you have symptoms, which would basically be gynecomastia, breast tenderness, maybe being too emotional, but unless you're actually having symptoms, you just leave it alone and it's fine.
Okay.
Is that what you think?
Yeah, sure. I've never touched aromatase inhibitors. I shouldn't see why you should worry about estrogen at all. It's just going up together with the testosterone. So
yeah,
just normal. Okay, so let's wrap this up so you can get to your appointment there. So together with all the viewers and all the people that asked questions, thank you so much, Amy, and see you on the next one.
Thank you so much for having me. Have a great day.
Thank you. You too. Bye-bye.
Bye.